I'm Willie McFarland. I'm a professor of Epidemiology and Biostatistics at the University of California in San Francisco. This is my fourth time to Bhutan, and we're here this week to conduct a training in scientific writing and publication. This is the third such training in Bhutan, and we've timed it to try to increase the productivity of manuscripts submitted to the Bhutan Health Journal. I am also a foreign editor for the Bhutan Health Journal. The BHJ is Bhutan's first public health and medical journal. It serves several vital functions. First, it provides a voice to local research and local data collected here in Bhutan, which helps set the agenda in providing data to base policy decisions on health issues that affect the Bhutanese people. The Bhutan Health Journal also serves as an important avenue for building research capacity in the country. For example, it's now required that medical training include research, that faculty career advancement requires publication, so the Bhutan Health Journal provides a voice for submission of manuscripts and publication. In the short term, this builds a body of literature on Bhutan health. In the long term, it also bolsters the capacity and enhances the confidence in researchers in Bhutan to submit to high-impact journals internationally. So it serves as a good incubator for research in Bhutan. Since this is my fourth trip to Bhutan in the last couple of years, I have a good perspective on seeing the progress that has been done. In the short term, we've seen an increasing number of manuscripts submitted for completion to the Bhutan Health Journal. But I think what's more important is the long-term benefit, that it creates a pipeline of research ideas that are being thought of, seeking funding, data being collected. So in the long-term perspective, I think the BHJ has had a catalytic effect on increasing the amount of research done in this country. So from my perspective, I've also seen the important role that the Bhutan Foundation has played in fostering a culture of research in Bhutan. First is their support of launching and sustaining the Bhutan Health Journal. Moreover, they have sponsored several research training workshops that include methodology, ethics, and scientific paper writing. And they've even sponsored pilot studies to launch young investigators in new lines of research in Bhutan. I would like to add that I feel very fortunate to be a part of this process early in the development of research in Bhutan, and I would like to thank the Bhutan Foundation for making it happen. I look forward to working with them in the future, and the privilege it's been to work with colleagues at the Medical University in Bhutan.